Hello, today we're going to take a look at an ongoing patient safety concern that is evident throughout multiple facilities. That is the amount of time that a patient spends in the emergency department waiting room, waiting for placement into a treatment area so that they can have their initial assessment done by a doctor and a nurse. Today, I will show you how we are able to decrease our emergency department wait times through a process called immediate bedding. The following is an example of a patient safety concern that has happened in emergency departments. A 44-year-old female presents to the emergency department with a complaint of upper back pain for the past few hours. She signs into the waiting room where she then sits down and waits over a half an hour to be called by the triage nurse. Oftentimes, a complaint of upper back pain can be missed as a potential cardiac event. And when there is a cardiac event, there are strict standards and guidelines in order to get the patients back to the cardiac cath lab within a reasonable time frame. Time is muscle, and when a patient signs in and sits down in the waiting room for over half an hour, the results can be detrimental. With long emergency department wait times, patients experience a decrease in satisfactory care. They often leave without being seen and experience delays in care, as presented in the previous scenario. There are multiple reasons why emergency departments experience long wait times. For example, it could be due to overcrowding, exponential growth in emergency department utilization, a decrease in inpatient hospital beds, which results in patients holding in the emergency department, and also an increase in observational admissions. Approximately 38% of emergency departments are operating at full capacity or overcapacity. Further adding insult to injury, emergency departments remain one of the highest risks and highest liability areas of a hospital. Why are emergency department wait times so important? Over the last 10 years, as volumes in emergency departments have increased, so too has the wait times for minor and serious health emergencies, such as MIs. Patients who leave without being seen are viewed as lost revenue and thus very important to capture. Studies show that when patients see a provider promptly, patient satisfaction scores greatly improve. And according to Centers of Medicare and Medicaid Services payment guidelines, emergency department visits are becoming linked to patient satisfaction scores. Our aim statement is for our hospital to decrease emergency department wait times from a current average of 2 hours for all patient visits by 50% by January 1st of 2020. There are multiple causes for long emergency department wait times. For example, patients that are admitted into the hospital being moved upstairs in a timely manner, patients being discharged in a timely manner, physicians coming in and assessing the patients in a timely manner, as well as when a patient initially signs in, there is nobody to receive them in the triage area. Also lab delays, radiology delays, medication delays through pharmacy, as well as simple equipment as stretchers not being available in rooms. Our strategies to improve emergency department wait times include having someone available at all times to direct patients back to a room. The beds will need to be immediately available for the patients in the emergency department. And the staff and patients will need to be responsive to immediate bedding. We will be using the Plan, Do, Study, Act framework for our project. This framework is a step-by-step process to allow you to implement a change, regroup, and analyze the outcome data with the possibility of adding changes once challenges have been identified. Within the first stage, the plan stage, we will identify the problems with long emergency department wait times. We will outline the possible causes as indicated by the cause and effect diagram. We will choose to have a trained staff member in the triage area at all times to receive patients and immediately escort the patient to a treatment area where the primary nurse will then complete the triage. The second step in our framework is the do stage. During this phase, we will identify what measures are doable, reliable, and consistently replicated. These variables will allow us to identify if improvements have been made. We will choose to implement the process of having a nurse available in the triage area on Fridays between the hours of 7 a.m. to 7 p.m. for 4 consecutive weeks. The third phase in our framework is the study stage. We will study the data after the variables have been applied. And after this process has been applied, we may find that the wait times were in fact decreased by 50%. We have chosen to target 2 process measures, the first being triage nurse availability. Ideally, we will have a triage nurse in the triage area every day, working 12-hour shifts, 7A to 7P and 7P to 7A. Initially, we are going to begin implementation solely on Fridays during the day shift hours of 7A to 7P. And the second process measure will be the time frame in which the doctor initially assesses the patient. We would like to hit a target time of within 20 minutes. After having the triage area staffed with a nurse for immediate bedding of the patients, we will be able to then measure our outcomes. The first measurement being the patient's left without being seen measure. We would like a target left without being seen of 10 patients per month. And then the second outcome measure will be our wait times that we will measure. The average wait time of a patient in our emergency room currently is 2 hours, and we would like to reduce that by 50% to 1 hour. The final stage in our framework is the ACT stage. And in this stage, we will learn to either utilize and adopt the plan as a new protocol or abandon the plan due to inefficiency and ineffectiveness. In regards to decreasing emergency department wait times, we will analyze whether immediate bedding decreases wait times by 50%. And if so, we will apply it daily as a permanent protocol.